Hello friends, I'm Dr. Pooja Rawat Mathur and today I will be talking about electives, which is a new career curriculum innovation program that has been included in the MBBS curriculum. We will be talking about the rationale of electives, advantages of electives, how to plan the incorporation of electives in the curriculum, what are the different types and examples of electives, how to plan for assessment in the electives, what are the responsibilities and role in monitoring of various bodies such as curriculum committee, MEU and the dean, and how to go about curricular governance of the electives. So electives is a learning experience created in the curriculum to provide an opportunity for the learner to explore, discover and experience areas of interest in the profession. It allows for flexibility and choice to the students and also provides an opportunity to explore the areas of their interest. It develops self directed learning and develops deep learning and critical thinking. It is a student centric module and it can also help the students to identify their future career path by providing direct experiences in various fields of their interest. These are the two important documents related to electives. First is the Graduate Medical Education Regulation 2019 and is the other is the electives module, which is provided by the NMC on how to go about the implementation of electives. So the relevant extracts from GMER 2019 are the objectives of electives, which we have already stated. We will move on to the curricular delivery of electives. So when are the electives supposed to happen? They are supposed to happen after completion of the part 1 of third MBBS examination and before the commencement of third MBBS part 2. The duration initially envisaged was 2 months, but now it has been curtailed to 4 weeks for 2019 batch, which is the first batch which will be having the electives program. It is a compulsory module and this time cannot be used for any other purposes such as completion of attendance in other subjects, ward postings, etc. So it has to be dedicated to electives. The learner shall rotate through two electives blocks of 2 weeks each. Block 1 will include pre-paraclinical or any other laboratory experiences or research project which is already ongoing. The clinical posting shall continue during this block, whereas in block 2 it will be clinical departments including specialties or super specialties, ICUs, blood bank, casualty, etc. It can also include electives in rural or urban community clinics, and there will be no clinical postings for this block. The institutes shall be responsible for determination of number and nature of electives, name of supervisors, and number of learners in each electives. The institutes will also develop mechanism for allocation of these electives, make a list of electives which will be available to the students ideally at the beginning of the academic year, and the learner must submit their logbooks based on both blocks of the electives. The student should be categorically made aware that 75% attendance and submission of logbooks during both the electives is required for eligibility to appear in the final MBBS examination. So, this is a brief timeline to plan the electives. First, the Medical Education Unit and Curriculum Committee will hold a meeting. Then, orientation program will be held for the faculty members. The HODs will develop learning modules and logbooks for their particular electives, which will be the list of electives will be updated on the institute's website. Students will be oriented as per the electives. Then a plan for allocation of these electives will be developed and the electives will be allocated to the students. Second orientation session for faculty and students and conduction of electives. Finally, once the program is rolled out and completed, there will be program evaluation which will depend upon the feedback from all the stakeholders. This is a very important document that is provided in the NMC booklet regarding electives, which will help you in preparing your electives. First is all the departments should prepare this learning experience for their particular electives, which will include name of the block, which will depend upon block 1 or block 2. If you are pre or paraclinical, you will fill in block 1. Or if you are clinical specialty, super specialty, it will be block 2. Name of the electives will be your name of the department. Location will be Medical College Hospital. Internal preceptor is the teacher or faculty responsible for running this electives module in your department. External preceptor if the program is running outside the institute. Learning objectives as per your departmental objectives that are set up. Number of students that can be accommodated in the electives. Prerequisites for the students, if there are any, are to be specified here. For example, if you require the student should have universal knowledge of universal precautions or basic life support, or should be immunized for certain diseases, then you should mention it here. Learning resources for the students, such as any books or handbooks that are prepared by the department, should be listed. List of activities in which the student will participate. What are the portfolio or logbook entries that will be required by the student? How will you assess the student during the electives? And any other comments are to be filled in and provided to the academic section of the institute. There are certain examples of block 1 and block 2. For block 1, laboratory experiences such as pathology, microbiology, biochemistry, genetics, molecular biology, immunology, pharmacovigilance, infection control, etc. Community outreach programs such as assisted living, hospice care, school health programs, maternal and child health will also come in block 1. Any other research, which may be student initiated or faculty research, community or epidemiological surveys, may also be included in block 1. Others such as bioinformatics, tissue engineering, computer and artificial intelligence in healthcare will also form a part of block 1 elective. These are just the examples. This list is not an exhaustive list. There are many other things depending upon the resources and the faculty which may be added as per the institute's protocols. Now, examples of block 2 will be clinical, specialty and super specialty experiences. For example, emergency room, intensive care, psychiatry, adolescence and reproductive health, neonatology, etc. etc. Super specialties such as hematology, oncology, rheumatology, nephrology, cardiology, GI surgery, organ transplant, etc. Also, it can include urban and rural community experiences, rural community health centers, primary health centers, etc. So, these are again just the examples. It can be expanded and more things may be added or omitted according to the resources available. These are certain comparison between block 1 and block 2. Both will happen according to the electives module before the commencement of third MBBS part 2, and the duration shall be, in this it is mentioned 4 weeks, whereas it will be 2 weeks each for 2019 batch. The focus of electives, as we have already talked about in block 1, will be pre-paraclinical as well as any laboratory experience. In block 2 it will be clinical, specialty or super specialty or community clinics. The nature of learning is supervised. Students are not supposed to take any individual care of the patient. It should be supervised, experiential, immersive, and self directed. Regular clinical postings shall continue in block 1, whereas it will not be offered in block 2 electives. Attendance, 75% attendance is mandatory. Assessment is formative assessment and it can include record of activities in a logbook or a portfolio. The out of institution experience for electives is allowed. Only thing that is to be kept in mind is that clinical posting should continue in block 1 electives, and out of city experience is generally not feasible in block 1 because the clinical posting should continue, whereas it may be allowed with prior approval in block 2. Now the students should be provided a written protocol of whatever learning experience and who are the preceptors in a particular elective at least 3 months in advance when the electives begin. The process of submitting application should be made available for both the blocks. Counseling sessions with faculty mentors to help the students choose the elective should be done. Students should be made aware of the rules regarding attendance, which is 75% attendance, work schedule, documentation regarding logbook and portfolio entries, and assessment methods that will be used for the electives. Allocation based on student choice and availability of faculty should be done according to the institutional protocols. Allocation sufficiently in advance with information should happen so that if there are any prerequisites for the elective, student can get the time to complete those prerequisites. Certain points to be considered when the student is joining an elective in a student research program, which happens in block 1, that there should be predefined work and monitoring and presentation which should be finalized before the electives. The availability of defined objectives, roles of student in the project, and also in publication of the project should be assigned before the choice of elective is made. Assessment by preceptor of the student role, contribution, involvement, and performance should be done, and the documentation of the same in a logbook or portfolio should be done by the student. Also, if the electives are happening in external institute, that is outside the medical college hospital in which the student is studying, if required, it is allowed, but there has to be an agreement with the external institutes as per the directives of NMC. Out of city or state experience may be decided based on the institutional policy. The clinical postings have to continue during block 1, so out of city program may not be feasible. Out of state electives in Block 2 require prior permission from NMC. Identifying suitable preceptors in the host institution and briefing them on the expectations is important to keep a liaising. So, a local preceptor or a faculty who can liaise with the external preceptor can ensure a smooth conduct of external electives. In any of the electives, student safety is paramount. Exposure to potentially hazardous situations should be avoided. Students need to be supervised and must not be involved in patient care as responsible health provider. So they should either observe or assist a healthcare provider but not be involved directly in a patient care environment. When required, student must complete prerequisite training such as good laboratory practices, universal precautions, good clinical practices, etc. before electives if it is stated by the department. Formal orientation that spells out expectations, outcomes, and precautions should be done with the students when they join the elective. Now we come to the assessment part of the elective. There is no learning without the assessment, so assessment should be clarified and predefined before the electives. 75% attendance, first of all, is mandatory. Logbook entry and their submission are required for the students to be eligible to appear for their final MBBS exams. The students may be assessed in between or at the end of electives. Feedback, comments, or grades by the faculty member may be given. It is only a formative assessment. The assessment elements could include participation in grand rounds, seminars, case records, submission of assignments, reflection on learning, preparation of abstracts or research posters, participation in patient education programs, etc. Performance of student in electives to can contribute towards internal marks but will not be reflected on the report card. Now we come to certain examples of electives. Department wise examples, for example, in anatomy, anatomy of any system, neuroanatomy, histological techniques, surgical exploration on cadaver can form the part of electives. Physiology, clinical nutrition in health and disease, biochemistry, blood work, pathology, fine needle aspiration cytology or blood centers, pharmacology, pharmacovigilance, microbiology, infection prevention and control practices, community medicine, research methodology and biostatistics, forensic medicine, crime scene investigation, ENT, hearing loss evaluation, ophthalmology, eye bank, medicine, electrocardiograms, surgeries, use of laser in treatment of anorectal venous disease, OBG, medical disorders in pregnancy, pediatrics, pediatric ICU experience, orthopedics, low back pain, radiodiagnosis, radiological imaging, psychiatry, addiction medicine, dermatology, leprosy, respiratory medicine, lung function test, anesthesia, role of monitoring in patient care in operation theatres and ICUs. These are just the examples. You can form your own objectives according to the faculty and resources in your department. This is how the performer or the learning experience can be designed for the students. This is just an example of block 1, for example, medical genetics. Name of the block is block 1. Name of elective is medical genetics. Location is Medical College Hospital. Name of internal preceptor depending upon the name of the faculty. Learning objectives in medical genetics can be to demonstrate the conduct of commonly available genetic tests in controlled environment, to enumerate indications of common genetic tests, to enumerate testing protocols for commonly performed genetic tests, etc. Number of students that can be accommodated is 4. Prerequisites are necessary immunization, universal precaution certification, learning resource for the students are a departmental handbook that is provided to the students during the elective, list of activities of student participation, work daily with the supervisor in observing, assisting, and performing genetic tests, participate in departmental educational activities, present at least two tests done by student as a case workup, portfolio required, documentation of worked up cases, documentation of presentation done, logbook entries require completion of posting signed by preceptor which meets expectation grade, assessment formative attendance, day-to-day participation in departmental activity, performance of assigned task, and presentation of worked up case in the department. Similarly, this is an example of block 2 diabetology, medical college hospital. The objectives, I will only read out the objectives and list of activities that the student is required to participate in. For example, the objectives for diabetology electives are to provide care for the patient with diabetes in supervised environment. Mind you, as it is written, it is supervised environment and not individually. To function effectively as team member in multidisciplinary team managing diabetes, to counsel patients about diabetes care, to describe pathophysiological clinical correlates as they apply to care of patients with diabetes. And the activities in which the students can participate are participation in outpatient and inpatient round, participation in afternoon teaching sessions, present at least two cases that are fully worked up, participate in patient education and multidisciplinary team meetings, participate in audit meetings. So this is what is expected of the student. These are the objectives. Now we come to program evaluation. After the program is rolled out, it is important to evaluate the program by the means of feedback based on information from all the stakeholders should be made in order to evaluate the effectiveness of the program and need for modification and improvement, and then again run the program with all the required changes. Now we come to the curricular governance, who is responsible for running and monitoring of this electives program. Curriculum committee of the college, headed by the dean, is responsible for design, conduct, implementation and evaluation of electives. Design and conduct of block 1 to be assigned to phase 1 and phase 2 subcommittee, and block 2 can be assigned to phase 3 subcommittee. Departmental heads and the preceptors are responsible for day-to-day conduct of the program, guiding, supervising and assessing of the program in their own departments. Now, responsibilities of the dean include that he or she will head the committee for implementation of electives with CC members and heads of electives as members, should hold regular meetings for effective implementation. The dean's office in each medical college will identify the persons or the departments in the college and will assign them the task of identifying, organizing, and administrative responsibilities for elective postings. Responsible person, office, or department will identify possible electives within and outside the institution and provide a list of all the electives to the students. They will also be responsible for training of the faculty. Now, responsibilities of the curriculum committee include they will help in sensitizing faculties and students for electives and its scheduling. They will also monitor smooth conduct of the program and coordinate with the dean, faculty, and students for various activities enlisted before. They will monitor and submit reports of the electives program to the dean. The responsibilities of medical education unit include arrangement of sensitization program for all related faculties, ensure coordination between faculty and students, and train and orient the resource persons, collect reports and coordinate with Nodal Center and Regional Center of National Medical Commission. So as it is a new program, there will be certain challenges and roadblocks, but with the effort of all the trained faculty members, we will try and do our best to implement the electives program. These are a list of resources that you can check out on the NMC website, which include the electives module as well as the GMER 2019 PDF. So happy learning.